Hi there. Welcome to the Health Analytic Insights Podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at healthanaliticinsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. So on this episode of the Health Analytic Insights Podcast, I have the honor of interviewing Lanre Tunji-Ajayi, and she's the president of the Sickle Cell Awareness Group of Ontario. So I'm really excited to get her insights and learn more about sickle cell disease. So the first question I have for you, Lanre, is can you provide listeners with background on your story with sickle cell disease and the Sickle Cell Awareness Group of Ontario?
Thank you, Alana. It's a pleasure to be with you and your audience today. So, as we know, sickle cell disease is a lifelong chronic disease. It affects people whose heritage are from Africa, Caribbean, Middle East, South America, South Asia, and it's basically found in every part of the world where there is also malaria-borne mosquitoes. I was born in Nigeria, West Africa, which is one of the countries, as a matter of fact, is the country with the largest number of individuals living with sickle cell disease. And I was born in a family of 8, and a few of my siblings have sickle cell disease. In 1999, I lost my brother to the complications of sickle cell disease. And after 5 years of mourning his loss, I decided I needed to do something about it. Rather than being depressed about my brother's loss, I decided to get up and do something. And that was what gave birth to the Sickle Cell Awareness Group of Ontario. We started as Seed of Life philanthropic organization, and we grow from there into Sickle Cell Awareness Group of Ontario in 2010. So we started the organization as Seed of Life in 2005, and by 2010 we realized that our focus is really sickle cell. So we changed the name to reflect that.
Okay, thank you. And thank you so much for sharing your story. And my own experience with sickle cell disease is I also have a lot of family members who have sickle cell disease, and I've seen the effects of it. And, in high school, I was able to volunteer for a sickle cell awareness group at Sick Kids Hospital. So again, I was able to see the effects that people go through this disease for their entirety of their life, and, some of the pain that they go through and how they have to manage that. So I really wanted to talk more and learn more about this disease as well.
I'm happy that you mentioned that you volunteered with the Sickle Cell Awareness Group of Ontario at SCAGO, and I think it's by engaging and getting the community involved. Volunteers are very important. They are key to what we are doing. So I want to thank you for that initiative that you have used to join and be part of what we do in Ontario. Thank you.
Yeah, no worries. And I think that, as you're saying, awareness is such an important aspect of it. Awareness can get funding, which can, help to continue on with these programs. And I think that more and more people, need to know about this disease. So can you highlight some of the important achievements that the Sickle Cell Awareness Group has accomplished since its inception?
Well, yes, definitely. So as an organization, we are the leading patient organization in the province. We provide service across the 4 regions of the province. In terms of programs, we provide disease management education program. to families. We believe that people need to understand the disease in order for them to ensure that they prevent complications, right? We also provide knowledge translation program to care providers.
Okay.
Many care providers are still now very knowledgeable about the disease as they should be. And so having the care providers program, whereby we are helping them to understand the disease, is helping to improve the quality of care that the patients are receiving. We support research. We also conduct our own research. One of the research studies we've recently done is to identify the hospitals in Ontario that are in need of education in order to improve the quality of care that they provide to patients. We also support health promotions, community awareness programs, and so on and so forth. Now, in terms of what we have achieved, while these programs are laudable themselves, we have also ensured that individuals in the province have access to life-saving drugs. We have, for those who are on continuous blood transfusion, we were able to advocate for the province to cover the cost of the blood chelators that they do need in order for them to not have excess iron in their system. So as you may know, individuals with sickle cell disease are now able to excrete iron like you and I. So if you're on continuous blood transfusion, you're having iron build up in your system, and that goes to every organs of the body. You need to get rid of those iron. So the drugs that will help you get rid of those iron, we work with the Ministry Ontario Drug Program, and we got those covered. So there, and currently right now, just for you to know, we have through the help of Honorable Member of Provincial Parliament Andrea Kajin and also Rudy Cachetto, we have introduced at the Ontario Legislative Assembly a bill known as Bill 255, which will help to proclaim June 19 as Provincial Sickle Cell Awareness Day and May 8th as Thalassemia Awareness Day. And for the sickle cell disease, this is in line with United Nations, right? Recognizing June 19 as World Sickle Cell Day and asking different nations with patients with sickle cell disease to create programs and raise awareness around this disorder. We believe that by having a day enacted in our province as a Provincial Sickle Cell Awareness Day, it will help to raise the profile of the disease. It will help to reduce the stigma that the patient experience. It will also help to improve the understanding and the knowledge of the policymakers, the care providers, and everyone that are involved with individuals living with sickle cell disease.
Wow, that's really amazing, and that educational piece is so important. I think both on the healthcare provider side and as well as the patient side, because that really allows you to empower yourself if you have knowledge of some of the common symptoms of sickle cell that might help you to not be misdiagnosed and things like that. So I definitely agree totally with the education piece and how it's important to have those courses and that education piece, both on the healthcare provider side and on the patient side. So that's really, really amazing that the Sickle Cell Awareness Group is working on that. That's really, really great.
Thank you.
And I also wanted to talk about the importance of sickle cell disease being included as part of the Newborn Screening Ontario program and what impact that has, sickle cell disease being part of, those list of diseases that are screened.
Yes. So in 2006, a few organizations met with the Ministry of Health and advocated for sickle cell disease to be included in the newborn screening program in Ontario. I wanted to say that this actually placed Ontario very high because Ontario was the first province
Oh,
to
wow.
actually include sickle cell in the newborn screening program. I mean, afterwards, we got other provinces to follow suit.
Mhm.
However, Ontario was the first province. Now, why is newborn screening important? Newborn screening is very important because if you must treat the individuals that have sickle cell disease, you must first identify who they are.
Mhm.
So it starts with diagnosing individuals with the disease. So the diagnosis is the first.
Mhm.
And to diagnose, you have to be able to identify them. And that is why newborn screening is very important. So when you identify the patient, then you can create programs to support them. You can give them prophylactic penicillin to ensure that they do not get infections. As you know, people with sickle cell disease are very susceptible to infections. And to prevent these infections, it's very important that they receive things like prophylactic penicillin or other antibiotics that they may need and so on and so forth. So this is why I believe newborn screening program is important. And I can
Absolutely.
tell you one flaw, though, I tell you with the Ontario newborn screening program is that he does not. So when a child is identified as having that the child has sickle cell disease, parents are alerted. They're told. But if the child has sickle cell trait, they are not told. You will have to request for that information yourself. And that is one of the things that we're talking to the ministry about to say individuals with sickle cell traits should also be provided, the information should be provided to the parents in order for them to better educate their children, even on their career status, right? But we do understand that for the healthcare providers to inform parents of carrier status, not the disease, but the carrier status, because the child doesn't have a disease. It's just a carrier of one copy of the gene. It should also be paired with counseling to help parents know that my child is not sick
Mhm.
by being a carrier, right? They just
Mhm.
carry a copy of the gene.
Right.
And so just to allay fears and anxiety, and also to help them understand, what should I be telling my son or my daughter as they get older, even with their carrier status.
Yeah, I think that's important information to know, if they meet with somebody else who might have the trait. So I guess like this is a whole, theme of this conversation, like knowledge is power, having that, understanding of what the disease is and if you're a carrier for it and so on and so on is, I think, really important knowledge to have for sure. And here at the Health Analytic Insights Podcast, we love to talk so much about technology and how it can improve health outcomes and advance healthcare. Do you think that technology can, in the future, play a role in managing sickle cell disease? What are your thoughts on this?
Definitely, definitely, Alana. One of my previous roles, I was the founding president and CEO for the Global Sickle Cell Alliance, which is the global umbrella
Mhm.
patient organization. And one of the programs that I was suggesting when I was in that role was actually an app whereby healthcare providers, for instance, from low resource countries. So let me just take a step back. We have a lot of resources for healthcare providers, especially in North America and some parts of Europe, like the UK.
Mhm.
Um, but when you think about countries that have the highest burden of sickle cell disease, we're not sure if the air care providers have access to an equal amount of resources as we do have in North America.
Mm. Mhm.
So, but this is where you have a lot of patients. Look at Nigeria in sub-Saharan Africa. Look at India with 1.8 million people with sickle cell disease.
Oh, wow. Mm-hmm.
You have these statistics. Why can we now find a way to bridge the gap between high resource and low resource countries by connecting the care providers and ensuring that they can pass information, they can translate knowledge to one another through this. So if there are best practices that are being followed in North America, we can share those with those in Africa, in South America, in South Asia, and it's all through technology.
Mm-hmm.
It's through technology. And I may not be able to attend maybe a conference with the American Society of Hematologists, but I can get the resources through this hub. So there are ways that we can really use technology to improve and support education with care providers, also with patients also. It can also help to help them manage their disease much better. They can manage symptoms and so on and so forth. So technology is definitely the way to go. And it will help to improve the quality of care, both from healthcare providers accessing valuable guidelines and educational tools, and from patients also being able to control their disease much better because they have access to different tools and different apps that can help them prevent complications and manage their disease.
Yeah, absolutely. And even to your point about the cross collaboration piece between education that you might have in North America, education that you might have in countries in Africa, like we're even now during the pandemic, 2020, we have this feature of Zoom. I've been on so many panels and conferences that have been online, so we can share that knowledge between different countries. And I think many places in Africa use cell phones quite for many different aspects when it comes to healthcare and finances and things like that. So having apps right on your phone that you can use to even write down, oh, I'm having this symptom today, I'm feeling this pain level today, and having that written down, and then you can, communicate that to your healthcare provider. I think it really is a benefit. And then we have things like chatbots, healthcare chatbots that can right away give you some frequently asked questions about sickle cell disease straight to your phone. So I think there's so many apps that exist today that we can kind of manipulate and kind of fix to kind of work with sickle cell disease and managing the disease. So I think that, we don't have to start from the ground up. Like there's things that already exist out there that I think can be applied to sickle cell disease when it comes to technology and healthcare.
Definitely. And if you think about it, even in clinical trials and so on, these technologies have been used to given to patients to kind of monitor their symptoms while they are on clinical trials and so on and so forth. So these are, there are, like you rightly said, there are a lot of apps and a lot of devices that are out there to support patient health. And I think we need to take advantage of them.
Absolutely. And when it comes to kind of building these technological projects, how important do you think the patient advocacy and getting insight from these patient groups are important when it comes to actually creating these tech projects?
I think I would say nothing for us without us.
Mm-hmm.
So if you want to create apps and other technological tools to support patients must be at the table from the beginning in order for you to have a clearer understanding of the gaps, what it needs, what is not currently helping them, and what is out there, what is not out there. By you knowing these facts, will you be able to design something that will be able to address those concerns and support the patient? So for sure, having patient advocacy groups and having patients with lived experiences involved in designing and developing apps and stuff is very, very important.
Yeah, and I think that everyone comes from it from a different perspective. If you're in the tech, you're coding this app, you have a different perspective of what it should be built. If you're, from the clinical side, you have a different aspect of how it should be built. But the patient is who you're serving, right? So you really need to get their understanding of how you need to build it, else people won't use the app at all because you haven't gotten their own opinion. So I really like what you say, like we have to have that patient input.
Yeah, like I always say, without us, I mean, how can you do something for someone without it being there, right? Nothing about us without us.
Exactly. That's really cool. So this has really been such a great conversation. And my last question is, when it comes to awareness about sickle cell disease, what message do you want to pass on to others who might just be learning about sickle cell during this interview?
Thank you very much, Alana. I would like to say that sickle cell disease is still very much misunderstood and undertreated in many countries, including Canada.
Mm-hmm.
And this is why the Awareness Day we are proposing is very important to shine more light on the disease. Many of the care providers have very limited knowledge around sickle cell disease. And this is the reason why many of our patients are still experiencing suboptimal care, even in Ontario hospitals. Sickle cell disease is lifelong chronic disorder. And there is so much stigma and discrimination that shouldn't be, but it is there. Mm-hmm. But if we work together, we can reduce those stigma, we can reduce the discrimination, we can ensure that there is optimal care available for patients. Care should be equitable and providing them with the right care at the right time. This is not the current experience. But we are working with the government, the current government, and we need the community to stand with us, support what we do to ensure that we improve the narratives when it comes to sickle cell disease, not only in our province, but across the country.
Absolutely. Thank you so much for that, Lanre. That was really awesome. And I hope that we can all achieve that goal. And I think it comes through, as you're saying, education and awareness. So thank you again so much for being on the podcast. And I hope you have a great rest of the day.
Thank you so much, Alana. And for those who may want to know more about our organization, our website is www.sicklecellanemia.ca. Thank you. We'd like to hear from you. And thank you, Alana, for having me on this podcast. Thank you.
I put all of the websites in the show notes of the podcast link, so you guys can check out all the resources there.
Thank you. And I wish everyone happy World Sickle Cell Day.
Thank you for listening to the Health Analytic Insights Podcast. I'd love to hear from you about topics I should cover in future episodes. Please consider subscribing and leaving a review. Have a wonderful day.